Well, one group yet to be impacted by the coronavirus, children. In China, only 2.4% of reported cases were kids. Only 0.2% of children became critically ill. That's according to the World Health Organization. And China has reported no cases of children dying from coronavirus. Joining us now with more is Dr. Eddie Fatakhov, a board-certified internist and nutritionist. Thanks for joining us, Doctor.
Thanks for having me on.
All right, so Doctor, it looks like kids are far less susceptible to getting COVID-19. Why is that?
There's multiple theories. So they did a study out of Johns Hopkins when they looked at the data with China, and what they found was kids actually are 8 to 10 times more likely to get the human coronavirus as a common cold than our adult counterparts. So the $64,000 question that they're investigating is these coronaviruses, do they have antigenicity and cross-reactivity that it's acting almost as a vaccine to help them protect against the COVID-19. In addition, kids, don't smoke. They don't do any of the stuff that a lot of elder people do. And then as a younger kid, you have your immune system is low, and as an older person, your immune system gets lower as well, right? Because immature immune system and then older immune system. Mostly when you see the flu, it affects kids and adults just as equally. This is the one time where we've seen it where it kind of skips the children, doesn't affect them, but it affects the adults and our elderly population to a great extent where it's deadly.
All right, well, help us understand how a child's immune system differs from an adult's, and does that let us in on any kind of potential vaccine? Is there anything that we can glean from the fact that children are not being impacted by this as much?
So the article deciphered and said that the pretty much inflammation is the biggest factor. So our adult counterparts, our adults, have more inflammation. So that once the inflammation cascade gets ramped up, that's what causes the organ failure and the respiratory issue that leads people on the ventilator. What they've seen in children, it does not do that. And we don't understand why it does not do that yet. Is it one, because their immune system is still growing? And so they don't have an immune system to defend it or create an inflammation response like the adults who have a robust immune system. That's one theory. The other theory, do they have protection because they're more likely to get in the common coronavirus cold? And one important statistic you mentioned when you started your talk about the WHO and the cause of deaths, one thing that's being missed from around the world, the media, is that nobody talks about in China that most of the deaths were middle-aged men in their 50s. They were factory workers and they were smokers, right? That is what we're seeing. Same thing with Italy, right? They're smokers, factory workers, northern Italy. So what we're saying is 80+% of the patients who get the coronavirus will have a common cold or will be asymptomatic.
Yeah, that's a very good point to keep on stressing, that this is certainly high-risk groups that have been dying. And as you say, environmental factors like air pollution, like people that smoke, have been the ones that are more susceptible to dying from this. The majority of the people do seem to have far milder symptoms. And we also know that there are over 66,000 recoveries when we throw out all these data. It's important to remember 66,000 people have actually recovered from this. Tell us about that process. How do people actually recover once they get the virus?
It's a great question. We had some patients here in Atlanta that actually had it, and they were asymptomatic. They came back from Italy, homeschooled. 2 weeks later, he was fine. So most of the people will either have just a cough or a cold or a common cold. You'll come to your doctor and say, I had a little fever and some cough and congestion. About 2 weeks later, it goes away and you're about your day. So that's what most of the people are experiencing. And that number that you mentioned, 63 to 66,000 recovering, I actually think that there's a lot, hundreds of thousands of people that are asymptomatic that have probably gotten this virus and already cleared it, right? Because when they announced this epidemic or pandemic from China, people were coming here in December to the United States, people coming here in November and October because they've kind of, didn't come out in the news media. So there's plenty of people that thought they had the common cold. They went to the doctor, got treated. A couple of days later, they got better, that had a normal immune system. And what I keep saying is that nobody should die from coronavirus, but when you still have 60 to 70,000 deaths from the flu, we didn't have this when we had the swine flu. We didn't have this pandemic when we had the H1N1, the avian flu. We didn't have this when we had Ebola, SARS, and MERS. Where was the outcry then, right?
Right. Well, I mean, but Doctor, you mentioned Ebola, and I like to stress the fact that Ebola has a 90% fatality rate, and the most aggressive estimates for the coronavirus fatality rate, and that's being aggressive, is about 3.4%. And to your point, we don't really know what the data is, because there are a lot of cases that have just gone unreported or untested. But very quickly, it's not that easy to get tested in the U.S. at the moment. If a patient wants to get tested, how do they do it? Tell us about the process that you're recommending.
That's a great question. So if a patient comes into my office, says, hey, I think I have coronavirus, I call the public health department from my state. Then we'll get a swab, we mail it out, and then they're having a backlog of tests, right? Because they're going to take care of the most critically ill patients. We're going to recommend home quarantine. But hopefully this week and next week, with the announcement of the bigger labs, LabCorp, Quest coming in, hopefully it'll be an easy process where I get a slip and they can able to handle a high volume. That mortality, 3.4% mortality, it's 0.1% with the flu annually, but we're only testing the high-risk population. So we start testing children and people that are healthy and people that have great immune systems. I think that percentage is even lower. I'm thinking 1%, maybe even lower, if we start testing the population, not just high-risk individuals who have diabetes, blood pressure, and present with the same symptoms from China.
Yeah, good point. Thank you so much, Dr. Eddie Fatakhov. Appreciate you joining us tonight.
Thank you. Pleasure.